Welcome, ladies and gentlemen. Welcome, dear colleagues and friends, live at the studios of ESC Congress 2021. I'm Stephan Achenbach, and it is my true pleasure to be here this morning with Stephan Windecker from Bern in Switzerland. He's the chairperson of the Congress Program Committee of this Congress. And Stephan, I think we both agree that we're looking back at 3 truly exciting Congress days. There's another one ahead of us, but even the past 3 days were, for me, truly impressive. What are your thoughts?
No, I only can echo your sentiment. Obviously, we all miss the online meeting with direct contact and
We
interactions.
miss the in-person meeting.
In-person meeting, yes, but nevertheless, I think we tried to make this meeting as lively and interactive as possible. So, for example, in the morning during the channel program, you are just watching. At 8 and 12 o'clock, we have the live program, and then importantly in the afternoon, we have the hotline sessions and the guidelines, and they are live from ESC Studio. They are very interactive and try to give you the taste of an in-person meeting.
Yes, absolutely. The guidelines are true blockbusters, particularly this year, heart failure, prevention that we're going to hear today.
Yes.
We had pacing and
Valvular
heart disease as 4 blockbusters.
Yes.
But Stephan, I know that people have an interest in facts and figures. So are there some numbers you would like to share with us concerning this ESC Congress?
Yeah, so certainly, people are interested how many are registered. So we have more than 39,000 registered participants.
That's absolutely amazing.
Yeah,
39,000.
if you put it in perspective with the on-site, in-person meetings, then it's actually more than this. So this is really successful. Yeah.
But do we have some numbers according, is this a truly global event?
Yes, so globally we know that from the participants there are more than 160 countries that are connected. If we focus just on what is presented from abstracts, we have more than 80 countries. And if you look at the faculty representations, then it is more than 50 countries. So really? Yes, this is a global conference.
Truly global event. Are there, Stephan Windecker, looking back at the Congress, are there any particularly impressive moments or studies that you have seen that stick out in your opinion?
Well, first I would say, as any year, the guidelines really constitute a very important core of the program, and that is not because it summarizes evidence base and arrives at the class and levels of recommendation we are used to. But the most important part is the implementation and practice. And there, the first-time presentation at an ESC Congress like this year, ESC 2021, is very important. And I think the topics you already mentioned, then they are of global importance, and they cover the entire breadth of cardiology. Now, beyond this, obviously, hotline, probably one that impressed me very much was the one on the first day, and that was Emperor Preserved.
And first there was almost a heart failure day, so to speak, right? There was Guide HF, then there was Emperor Preserved with lots of discussions around it, so that was truly impressive. I would fully agree.
And just to put it in context, so far, really this is for the first time that in patients with heart failure and preserved ejection fraction, you have a treatment that is effective and is highly effective. I think people were very positively surprised about the extent of the benefit. And this is certainly a new era in the treatment of patients that are affected by this disorder. But I thought it was also interesting to see the change in the perception of what heart failure constitutes, where it begins, at which ejection fraction, and so on. So certainly this will be time for an update.
Absolutely. I mean, more data showing that this concept that heart failure with reduced ejection fraction is below 40%, might not be holding up, because all the trials now show benefit in individuals who have ejection fractions above 40%, but have structural heart disease. So we might need to rethink that over the coming
But tell
years.
me, what impressed you most?
Well, I think there's a number of ways in which these late-breaking trials can influence us. One is data that you take home and you can implement, tomorrow morning in your own hospital. And one such trial is Tomahawk, for example. It was a negative trial looking at patients after out-of-hospital cardiac arrest. Do they need an immediate coronary angiogram if they don't have ST elevation? And this trial, confirmatory in nature, yet very clearly shows no, we don't have to force the patients to the cath lab. The outcome is not better. So particularly in hospitals who don't have a cath lab, you don't have to transfer those patients. It's very important for clinical practice.
For logistics, it's really important because you can take your time, you can do a thorough assessment. I think the open question is how much time you take now and what is the appropriate procedure. You await the neurologic recovery and so on. So as every great study, it raises a lot of new questions.
And then there are some trials, now as you say it, Master DAPT, that's a trial that you were actually involved in, which very convincingly shows that 4 weeks dual antiplatelet is possible. In this patient cohort, they were all treated with a specific stent. Very convincing results. There's no downside to shortening the dual antiplatelet therapy to 4 weeks, 30 days. But of course, it was done with one particular stent. And my question would almost go right back to you. And how can we transfer this? Is this a limitation where we say, no, we have to wait for more data? Or is this also something that we can apply as we go back to our hospitals, go back to our practices this week?
Yes, so I would highlight Marco Valgimigli, who is the principal investigator. He really needs to be applauded because he did the first randomized clinical trial that addresses the specific question of that ultra-short 1 month DAPT versus what has been discussed as standard of care. But we need to see that study in the context of several other studies. And there have been other studies that investigated different stent platforms with shorter durations. And I think if you look at the entire field in high bleeding risk patients, it looks like that in shorter duration indeed is the preferred treatment due to the improved bleeding profile. I just would say today there will be another study, but now in the setting of acute coronary artery disease.
Study from Japan, Stop DAPT2. So that's going to be important. I have to say that in another sort of trial that is always intriguing are the small ones that are a little bit out there, not really mainstream. And one that really I remember when it was presented was the trial with drones delivering automated defibrillators. This was a big effort to do. In the end, a relatively small number of cases where they delivered drones to resuscitate patients who had cardiac arrest and dropped them and were able to drop them within 9 meters of the event. 2 minutes earlier than the ambulance would arrive. Of course, lots of caveats around this, but these trials also give you interesting ideas, and I applaud all the investigators who come up with these very creative concepts for completely new ways of treating patients with cardiovascular disease.
Absolutely disruptive, yeah.
But also time to look at next year, Stephan. Next year, Barcelona 2022. We will be in Barcelona, August 26 to 29. Here are the Congress visuals. They look very promising. What are your thoughts as we already start thinking about Barcelona 22?
Sure. So ESC Congress 2022 will be in Barcelona. It will be a hybrid of an on-site and online meeting. And I can assure you we make this as attractive as it can be, and you will have the possibility to choose what suits you best. Obviously, we all hope that we can return to an on-site location to also have the direct interaction, which is critical for a meeting like this. Yet we will capitalize on the opportunity to continue with the online format because many people may be able to connect in addition to our on-site activities.
The magic of cardiology will be the motto for 22. I think it applies to this year just as well. A fantastic Congress. And once again, thank you, Stephan, for putting it together. The way you have done this is absolutely fantastic. Ladies and gentlemen, we have another exciting set of channel programs ahead of us, and then a truly fantastic afternoon with a prevention guideline and more hotline trials. Thank you very much for your attention and enjoy the rest of the day.